Introduction. Hello friends. Heart disease is one of the leading causes of death worldwide, and many rely on statins as a solution. But do statins truly reverse heart disease? Can they actually heal damaged arteries or stop the progression of this deadly condition? I'm Dr. Balaram Dhotre, a researcher passionate about uncovering the root causes of chronic diseases. In today's video, we'll explore the science behind statins, their limitations, and what you need to know about heart health. Let's dive into the truth behind this widely used medication. 99% people do not know this important information. Taking statins does not reverse heart disease, but nutritional therapy can. Statins. Are you doing the right thing by taking statins? Statins are drugs that reduce your body's cholesterol level. They work by inhibiting the production of cholesterol in the liver and in this way lower your risk of coronary heart disease. Cholesterol is essential for your body. It performs several important functions in the body. If too much of LDL, bad cholesterol, is present in the body, it can lead to fatty deposits building up in your arteries, atherosclerosis. These fatty deposits can increase your risk of developing conditions such as coronary heart disease, heart attack, and stroke. Why you are advised to take statins? People who suffer a heart attack or stroke will be advised to take a statin to help reduce the risk of them having another event. You'll also be advised to take a statin if you are considered to be at significant risk of developing cardiovascular disease or of having a heart attack or stroke. Even if your cholesterol level isn't high, you may be prescribed statins to help protect you. About 1 in 250 people in the UK have familial hypercholesterolemia, FH, an inherited condition that causes high levels of cholesterol and which can also be treated with statins. How long do I need to take a statin for? Probably for the rest of your life, because they only work for as long as you continue taking them. In conventional medicine, you are treated for symptoms. High cholesterol is a marker for heart disease. Whether high LDL cholesterol really damages arteries is not known. High cholesterol is associated with the causation of heart disease. The cholesterol levels are low only till a statin drug like atorvastatin is present in the body. When the drug effect is over again, liver will start making cholesterol. You cannot expect disease reversal. You can just manage your cholesterol levels. How will taking statin help me? It can significantly delay the onset of atherosclerosis, narrowing of the arteries, and reduce the risk of having a serious event such as a heart attack or stroke. Interpretation: if your LDL cholesterol levels are high, the LDL cholesterol will go and deposit in the arteries. So, your clean arteries start getting clogged. Suppose that without taking statins, the clogging of arteries will be seen after 2 years. By taking statins, the time to see the arteries getting clogged may be extended to 5 years. It is some sort of a preventive measure and not a reversal process. Correctly speaking, it is a delaying system. Statins also slow down the progression of disease, so they can help delay symptoms such as angina, chest discomfort, or breathlessness. Interpretation: if your arteries are already clogged, then without statins you may get symptoms of angina, pain, or heart attack, say after 5 years. But if you take statins, you can see the symptoms of angina, pain, or have a heart attack after 10 years. They won't reverse the symptoms, but they can prevent them from getting worse. Are you happy with this treatment for heart disease or stroke? Cardiovascular diseases are increasing at an alarming rate worldwide. Statins are not able to reverse coronary artery disease. Even while taking statins, you will be suffering from high cholesterol problems. Your cholesterol levels will not be in the normal range. After 6 weeks of taking statins, your cholesterol levels stabilize. Almost near normal level. Is this the end of statin therapy? No. You get your cholesterol levels checked after 6 months or a year later. If the levels of cholesterol are high, again start taking statins. It is a lifelong process. Personally, I am not happy with statin therapy because it is not a 100% preventive measure. If a healthy person starts taking statins regularly, there is no guarantee that LDL cholesterol will not get deposited in the arteries and will not get a heart attack. If I already had a heart attack or have coronary artery disease, I can still have a heart attack a few years later. This treatment method is just trying to lower LDL cholesterol levels. But what about the LDL cholesterol that is already attached to the arteries? Statin therapy does not remove the arterial plaque. The latest research shows that high LDL cholesterol is not the main risk factor for heart disease. It is lipoprotein A, also called a ALP cholesterol, which is the main risk factor of heart disease. It is elevated levels of ALP, a cholesterol, which is the main risk factor of heart disease. Statins do not lower ALP, A, cholesterol. It is ALP, A, cholesterol which is getting attached to arteries, atherosclerosis. It does not make sense to take statins if it is not lowering ALP, A. What type of cholesterol-lowering product you would like to have? Instead of just lowering LDL cholesterol, it should normalize cholesterol levels. After medication, the liver should start making cholesterol levels in the normal range. Both HDL and LDL and ALP should be in the normal range. If I am, the product should be able to remove the LDL ALP, a cholesterol that has been deposited in the arteries. Statins do not lower lipoprotein A. Latest research shows that lipoprotein A is an emerging risk factor for heart disease. So far, high levels of LDL cholesterol was considered as the primary risk factor of heart disease. The situation has changed since 1990 with the discovery of ALP, A, cholesterol as the main constituent of the arterial plaque. This pushes down the LDL cholesterol as the secondary risk factor and lipoprotein A as the primary risk factor. The root cause of chronic diseases is a deficiency of micronutrients. Deficiency of vitamin C and deficiency of other nutrients involved in collagen synthesis cause arteries to form lesions. This then triggers the formation of high LDL cholesterol levels and also high levels of lipoprotein A. Lipoprotein A is synthesized in the body from LDL cholesterol. Thank you for joining me on this critical discussion about statins and heart disease. Understanding the real effects of medication is vital to making informed health decisions. If you found this video valuable, don't forget to like, share, and subscribe to my channel for more evidence-based insights. Let me know your thoughts or questions in the comments below. I'd love to hear from you. Remember, staying informed is the first step towards better health. See you in the next video.